Hi, I'm Dr. Simon Fry, consultant in clinical neurophysiology. Welcome to my YouTube channel. Over the past year or so, I've concentrated on providing educational content mostly relevant to peripheral nerve and muscle disorders, and now I'd like to shift focus towards supporting patients with epilepsy. Of course, there already exist online multiple resources from big organisations, big support groups, which of course I cannot match in terms of the complexity of the content, even making these videos of a slightly better quality, more cinematic use of actors, etc. I can't do that, but what I can do, hopefully, is to provide clear, concise, evidence-based information and the opportunity to create a community forum for further discussion of really what are quite important topics and sharing of common experiences and advice. So here's a list of potential topics which I'll just talk you through. Of course, in the first one, which I'll be talking about, what is epilepsy? Possibly different types of epilepsy, talk through those, the mechanisms and causes of epilepsy, how we investigate epilepsy as well, that might be an interesting topic, principles of treatment, mimics of epilepsy, there are lots of things that can look like epilepsy but aren't. Then of course there are some more specific topics. Driving in epilepsy, that's a difficult subject to talk about, but hopefully we'll have something to say about that. Travel, mood, depression, anxiety, stress, sports and epilepsy, topics relating to women, children, education, learning disability, a particularly difficult one, death and epilepsy as well. We can also talk about alcohol and drugs, diet, epilepsy surgery. We can talk about specific types of epilepsy syndromes or particular types of seizures as well. And of course we can always talk about EEG as well, although that's a much more specialist subject. So please subscribe and join the conversation with your thoughts, your ideas, comments, suggestions, particularly now at this point. And if there's something that I've missed out, or if there's something that's really important that I should be talking about sooner rather than later, then again, please do let me know below. And this is not exhaustive by any stretch. There are, of course, a few house rules that I would like to introduce at this point. Rule number one is it's really important to keep comments constructive. Really, really important. Number two, anything that you want to keep personal or confidential should not be disclosed on this forum. YouTube is a very public place, and once information is out there, it's out there. It's very difficult to do things about that. So if there's anything personal, that shouldn't be disclosed. Number three, it's really important, and follows on from the previous item, is to keep comments as general as possible and not about any individual needs or queries, really. It's very difficult for me in terms of what I do and my abilities to support you with regard to answering individual queries, individual questions about symptoms, investigations, treatments, those kind of things. And this is not really the place for it, and that has to really be done in conjunction with your local healthcare providers. So this isn't really the place for that, unfortunately, and I hope you can understand that, and I apologise for that, but I'm just not in a position where I can do that for you safely or reasonably, so that's just something that I won't be able to really do for you. Number four, I'm going to be talking about some difficult topics, and there will be viewers who have unfortunately had negative experiences, and of course it's very important for all of us to be able to learn from them in their generality rather than in the individual setting. So if there's any specifics, that really shouldn't be talked about. Sometimes people have negative experiences with individual healthcare providers or services, and this is just not the forum for it. And just remember rule number one, which is all comments, please do keep them as constructive as possible and as positive as possible. Finally, this is a personal bugbear. This is not the place to advertise goods or services, and I just have no time for that. This is really a place for people to be able to learn from each other, to share their experiences, what works in a positive sense. It's really useful for that, I think, and I hope you'll get benefit from that too. So please bear with me with that. Finally, of course, I really do value your input, particularly at this point now where I'm still at the R&D stage. Hopefully I'll be starting soon with providing content, but please do let me know what you think below. Support the channel, do like, share, subscribe, use social media, to get the message out there. I am trying to do this for you, and hopefully you will find it beneficial and useful, and please do let me know how it's going. Really do value your support. So I'm looking forward to hopefully releasing the first video in the series in the very near future, and that will be on what exactly we understand by epilepsy, how's it defined. So that'll hopefully be the first video, and looking forward to seeing you and hearing your views. All the very best.